During a scientific conference, neuroscientist Vilayanur Ramachandran recounted a fascinating story about an unusual patient. This patient had one half of his brain as an atheist, while the other half was a believer. Our story begins by going back in time to the period between the late 1950s and late 1970s, when there was a widespread belief in the scientific community that the best way to treat severe epilepsy was to separate the right hemisphere of the brain from the left hemisphere. This was done through a surgical procedure that involved cutting the connection between the two hemispheres, known as the corpus callosum. For over 40 years, doctors performed this procedure on numerous epilepsy patients. Despite the harshness of this operation, it significantly alleviated the symptoms of epilepsy. It is important to understand that epileptic seizures occur randomly and suddenly. So, at any moment, you might see an epileptic patient fall to the ground and experience a frightening seizure. To imagine the danger of epileptic seizures, consider this scenario. One patient had a seizure while working in a bakery, resulting in some parts of his body getting burned and injured. As we mentioned, the seizure is sudden and can happen at any time, making it uncontrollable. This led many people to be willing to take the risk and undergo the procedure that involves severing the connection between the two hemispheres of the brain, thus losing the communication link between them. However, if you focus a little, the meaning of cutting this connection between the two hemispheres is extremely significant and can be terrifying. Imagine that one half of the brain does not know what the other half is thinking, which is not a simple matter at all. And who knows, perhaps the second half might start conspiring against the first half. After this procedure, patients took hours to make some simple decisions. But why does this happen? In very simple terms, the right half of the brain is responsible for the left side of the body, and the left half of the brain is responsible for the right side of the body. Since the connection between the two brain hemispheres has been cut, each half now acts independently. This means there are effectively two persons in one body, as each hemisphere controls its corresponding half of the body. Now, imagine a patient trying to buy a shirt. Each hand may select a different shirt, as the two halves of the brain are no longer communicating and coordinating. In essence, the body begins to fight itself, with each hemisphere trying to exert control over the other half without any ability for the two sides to communicate. At one of the conferences, Dr. Ramachandran presented a case that amazed people, demonstrating a clever ruse. The ruse was as follows. When he wanted to know a specific answer from the right half of the brain, he would whisper into the left ear. When he wanted to hear a particular answer from the left half of the brain, he would whisper his question or request into the right ear. Now, why did Ramachandran employ such tactics? Because the left hemisphere of the brain is responsible for the communicative aspect of the entire body. It is responsible for language. Therefore, no other part of the brain can speak. In other words, since the patient has only one mouth, it is clear that the left hemisphere of the brain, which as we said is responsible for language, will be the one to use the mouth. In this case, only the left hemisphere will speak and its story will be heard, while the right side remains isolated. Now, you might wonder, how would we get answers from the right hemisphere if it couldn't speak? This is achieved by using the left hand, through which the right hemisphere selects one of the options: true, false, or I don't know. Here is a peculiar case that has arisen after asking each hemisphere whether God existed. Although the left hemisphere believed in God, the right hemisphere was an atheist.
Is this possible? Can this be true? A believer and an atheist in one body. How did this happen?
The audience was astonished by such a case, especially since many philosophical questions might come to mind after hearing the story. At the end of his lecture, Ramachandran posed an existential question. which of the two contradictory halves of the brain represents this patient? Will this person be judged based on the beliefs of the left hemisphere or the thoughts of the right hemisphere? Let's move on to Michael Gazzaniga, a prominent American neuroscientist with some remarkable studies. He used to look for patients who had undergone split brain surgery and focused on them in his research. His studies were extremely peculiar. Gazzaniga observed that when he brought one of these patients, closed their left eye, and made the right eye, which is connected to the left hemisphere of the brain, look at a painting by the artist Arcimboldo, known for creating faces using arrangements of fruits and vegetables. The result was that the patient, or more precisely, the left hemisphere of the patient's brain, reported seeing vegetables and fruits and could not recognize the face. But why does this happen? Simply because the right hemisphere of the brain is the only one capable of perceiving and recognizing faces. In this case, the left eye was closed, so no information reached the right hemisphere of the brain. This left the left hemisphere of the brain to conclude that it saw fruits and vegetables because this hemisphere is incapable of recognizing faces. A healthy person like you and me, when looking at the painting, will easily recognize that what they are seeing is a face made of fruits and vegetables because, in our case, the right hemisphere communicates with the left hemisphere. However, patients who have undergone split brain surgery, when they see with their right eye, they will tell you they see fruits and vegetables, and when they see with their left eye, they will tell you they see a face. All these contradictions and differences occur within the same body. Gazzaniga, the scientist and researcher, discovered other things as well. For healthy individuals, it is difficult to draw two different things using both hands simultaneously because the two hemispheres work together, creating a sort of noise in the brain. But a person with a split brain has no such problems. They are capable of drawing with both hands at the same time. A healthy person can easily tell you what is on their left side. If you look at things on the left side of your vision, you can easily tell me what you see. But patients with split brains cannot verbally tell you what they see on their left side, but they can draw what they see with their left hand. As we mentioned earlier, the Ministry of Information and Linguistic Aspect, represented by the left hemisphere, is responsible for the right side of the body and does not know what the left eye sees. Therefore, when we ask the patient, "What did you see?" they will not be able to verbally describe it. However, their right hemisphere, which controls the left hand, can express what it sees through drawing. Therefore, when asked about objects on their left side, they are unable to verbally respond but can draw what they see with their left hand. When he asked the right hemisphere to grasp something and then asked the left hemisphere responsible for speech, "Why did you pick up this thing?" the left hemisphere invented a story on the spot. For instance, Gazzaniga would whisper to the left ear, which is connected to the right side of the brain, to make the patient grasp an apple with the left hand. Then he asked the patient why you picked up the apple. The patient was replying that he did it because he was hungry, even though the primary reason for picking up the apple was because the doctor instructed them to. From this, he concluded that the left hemisphere of the brain was inventing and concocting reasons to explain the action of picking up the apple, even though it had no role in the actual picking up of the apple. If you think this is ordinary talk, let me tell you it is very serious. This means that despite there being no authority making the left brain hemisphere pick up the apple, this left hemisphere was adept at interpreting things it had no choice in doing. In other words, after the action, the reason was created. In conclusion, I encourage you to deeply contemplate this matter as it has ignited extensive debate within scientific circles. It leads us back to one of the most intricate intellectual quandaries in history, whether humanity possesses free will or is determined. In this case, it could be determined, but the left hemisphere creates a narrative that convinces the individual that they are responsible for making the choices after the decisions have already been made. Thank you for staying until the moment. Do not forget to subscribe and support us with the like button.